Good morning, everybody. I would like to welcome you all to today's COVID-19 briefing. Today, I am joined by my fellow Commissioner, Vice Chair Ken Lawrence, as well as several representatives from our local area hospitals. With us today are Dr. Robert Sinsilla, Chief of the Department of Emergency Medicine, Einstein Medical Center, Montgomery of the Jefferson Health System, Dr. Keisha Martin, Chair of Emergency Medicine, Redeemer Health, Dominica Lysy, RN, Director of Emergency Observation and Transportation Services, Redeemer Health. Dr. Neil Galati, Medical Director, Emergency Department, Pottstown Hospital. Dr. Rich McLaughlin, Chief Medical Officer at Pottstown Hospital. And Dr. Jonathan Stallkamp, Interim Chief Medical Officer and Regional Vice President of Medical Affairs, Mainline Health for Bryn Mawr Hospital and Lankenau Medical Center. I want to thank all of you for taking the time out of your very busy schedules to join us today. Supporting our hospitals and frontline healthcare workers has been a priority since the first days of this pandemic. We meet regularly with our hospitals to make sure we are doing everything we can to support them during this current COVID-19 surge. Today, I will start with a short update on the surge in Montgomery County, and then we will hear from 4 of our hospital representatives. They're here to share important information about how their respective hospitals are responding to this surge and what our community can do to help. Montgomery County continues to experience an unprecedented number of cases of COVID-19, most likely due to the rapid spread of the Omicron variant. Let's take a look at our current numbers. We'll start with our positivity graph, which is current as of January 13th. You'll see that our positivity rate is now running at 28.84%. As a reminder, the orange line on this graph represents the number of PCR tests performed each day, and the blue line is the 14-day PCR positivity rate. And I do just want to note that in all this information that we're sharing with you today, this data represents PCR tests only. This does not include any of the at-home antigen tests. Next, we'll look at our date tested graph. And as a reminder, the gray bars on this graph are the number of people who tested positive with a PCR test on any particular day. The red line is the 7-day average of all cases, which as of January 12th is at 1,067 cases per day. You'll notice that this line peaked during the last 2 weeks and is now trended slightly downward. I don't think enough time has gone by to say with certainty that we are on the other side of the peak, but I am encouraged to see that this line is trending down. The orange and yellow lines at the bottom represent the 7 and 14-day averages from our long-term care facilities, which remain low. Next, we'll take a look at our current hospitalizations. As of yesterday, we have 564 people in a Montgomery County Hospital with COVID-19. And you can see that over these past several days, we have hit the peak of hospitalizations in our county since the pandemic started. And we'll obviously be hearing more about that shortly. And then finally, this next graph shows our cases per 100,000 residents. So these are Montgomery County cases per 100,000 residents. This is the easiest way to compare cases across different jurisdictions that have different populations. As of yesterday, the county is at 898.9 cases per 100,000 residents. And again, these are PCR tests only. So you can see that we have really hit our peak throughout this entire epidemic, but there are also hopeful signs here. We're not out of the woods yet, and our hospitals remain quite busy. But our hospitals have told us that they needed help with COVID-19 testing, and the county has quickly stepped up to meet that need by expanding the county's PCR testing capacity. Last week, we added 1,500 new weekly appointments at our 5 community testing sites to serve our residents. In total, we've added 6,000 appointments in the month of January. With more testing available in our community, we want to remind our residents not to go to the emergency room for COVID-19 testing, but do not hesitate to go for a medical emergency. To make an appointment at one of our testing sites, visit montgopa.org/COVID-19 testing, or you can call 610-970-2937. Appointments can be made up to 4 days in advance. Walk-ins, unfortunately, are not accepted at this time. And also, starting yesterday, anyone can now go online at covidtests.gov, that's covidtests with an S.gov, and order free at-home COVID-19 test kits. Each household is eligible to order 4 free tests that will be delivered by the United States Postal Service in the next 7 to 12 days. If you're not able to access testing and you are experiencing symptoms of COVID-19, you should isolate for the recommended 5 days to keep from spreading the illness to others. You should continue to monitor your symptoms and contact your primary care provider for guidance, particularly if you're at high risk of severe COVID or are experiencing symptoms that are concerning. Now we'd like to give our hospital representatives a chance to share what's been going on in their hospitals, on their patient floors and their emergency departments. And we're going to start with Dr. Keisha Martin, Chair of Emergency Medicine at Redeemer Health. Dr. Martin?
Thank you. So we have encountered a dramatic rise in the number of emergency department visits recently. Many of these patients are very sick. However, there are a fair number of patients who are coming purely for testing. It's important that emergency departments are continued to be utilized for emergencies and not as a testing site. We have patients who are coming with absolutely no symptoms, with very mild symptoms. Employers who are sending patients to the emergency department for testing. And when this happens, it delays care for patients who have true emergencies. It diverts life-saving resources away from the hospital and away from those patients who really need it. So if you have concerns about COVID, if you need to have a COVID test, you should be calling your primary care physician. You should be visiting urgent care centers and the testing sites that have been given to you just now here on this program. But absolutely, if you have chest pain, you're short of breath, your doctor's given you a pulse oximeter and your oxygenation is low, you need an emergency department. And by all means, please come to the emergency department. We just want to make sure that all of these resources remain available to those who really need them.
Thank you, Dr. Martin. Next, we're going to hear from Dr. Robert Sinsilla, Chief of the Department of Emergency Medicine at Einstein Medical Center, Montgomery.
Thank you, Dr. Akush. Good morning, everyone. I have to reiterate many of the things that Dr. Martin said. Our goal in the emergency department is to serve all of our patients that are able to come here, especially those that are most in need in the community. And by no means do we want a patient to stay home if they have a serious or life-threatening or critical illness. So let's make that first and foremost very clear that if you are ill and you have symptoms that can't be handled at home, don't hesitate to come to the hospital. We will absolutely see you and take care of you. Our goal is to treat our patients in our community without hesitation. With that being said, we are very busy like everyone else, but we're managing through it. We are really optimistic between Einstein and Jefferson about managing this COVID surge and getting to the other side of it. We're all really excited with seeing maybe a small decline in patients and hopeful that that spike will drop just as soon as it rose. We have stayed committed in providing excellent care to our patients, and that is due to the resiliency of the healthcare staff that we have within our emergency departments. And I probably say that for everybody on this Zoom meeting this morning, that the resiliency of our staff, our nurses, our housekeepers, those people that help support the emergency department and the inpatient hospital beds has been outstanding. And if it wasn't for them, we wouldn't be able to do what we do every day. We encourage the community to utilize the outpatient testing sites that Dr. Arkush talked about this morning as well. and not to come to the emergency department just for a test. Or if you have very mild symptoms that can be managed at home, the best thing you can do, again, is to isolate for those 5 days and to reach out to your primary care physician should you have any questions. And if you start to deteriorate or you're feeling worse, certainly come to the hospital and we will take care of you and take a look at you. Again, to talk about those patients that might have illnesses outside of COVID, it's important to recognize that if you're having chest pain, if you're having shortness of breath, if you're having symptoms of a stroke, don't hesitate, don't delay coming to the hospital, because we need to take care of you in a very timely fashion in order to provide the best care.
Great. Thank you, Dr. Sensilla.
Thank you.
Next, we'll go to Dr. Neil Galati, Medical Director of the Emergency Department at Pottstown Hospital. Dr. Galati?
Hi, thank you, everybody. I'm going to echo what Dr. Martin and Dr. Chinchilla have to say. Very similar message. Montgomery County hospitals are open, safe, ready to deliver all healthcare needs. Patients should not risk their health by delaying urgent and emergent medical care. If you or a loved one has symptoms such as shortness of breath, chest pain, extreme dizziness, or stroke-like symptoms like inability to walk or talk, call 911 immediately for evaluation and treatment to the closest emergency department. While COVID-19 is still prevalent, all healthcare facilities are following recommended safety measures to maintain a clean and safe environment. Everyone at Pottstown Hospital and all the hospitals in the county are working extremely hard with tremendous dedication to care for our patients and community under these very, very difficult circumstances. There's a few ways the public could support this the healthcare team. Number one, they could get vaccinated and boosted against COVID. Number two, they could wear masks and social distance as appropriate, especially wearing masks in all public settings. And number three, just be patient and encouraging of the caregivers that are working. We're very busy in these emergency departments, and with volumes up, there might be waiting that will have to be done. So just be patient, and a thank you goes a long way.
Well, thank you, Dr. Galati. We so appreciate your being here and sharing those wise words. And last, we're going to hear from Dr. Jonathan Stallkamp, Interim Chief Medical Officer and Regional Vice President of Medical Affairs for Mainline Health, Bryn Mawr and Lankenau Medical Centers. Dr. Stallkamp.
Thank you, Commissioner Arkush. Again, I would echo all that our other physicians have said about really trying to avoid the emergency room as much as possible around testing. Our numbers have gone up significantly, just like everybody else, and we've hit record numbers with this last surge. Hopefully they are trending down for us. Hopefully that continues. Again, I would echo the best things to do are to get yourselves vaccinated, wear that mask, and try to avoid the ER for testing. And another plea that I would ask for people too is to get out there and donate blood. A lot of times with the way healthcare has been and people are afraid to come to the hospitals or go to a blood donation, our hospitals are also seeing a definite decrease in the amount of donors out there, and our blood supply is at critical levels. So please, by all means, get out there and donate.
Thank you, Dr. Stallkamp. Well, thanks to each of you for these important updates. It is so clear that our frontline healthcare workers need our support now more than ever. And you can support them by getting vaccinated if you're not vaccinated. It's time. It is the very least that we can all do to honor our frontline workers, protect our hospitals, and keep our family and friends safe. If you're due for a booster, please get boosted. Wear a mask, a high quality mask indoors, and keep gathering small and if possible outdoors. So thank you all so much for joining us today, and we are happy to open it up for questions. Ms. Co-Francisco, let you manage that.
Thank you, Commissioner Arkush. So for the members of the press logged in today, we ask that you please use the raise your hand feature to indicate that you would like to ask our speakers today a question. We do ask that you please address the speaker that you will be asking that question to, since we do have a number of folks on the call today. And we do ask that you please limit your first round of questions to 2 per person so we can get through to everybody. So we will begin today with Jim Melwert of KYW.
I don't know who wants to field this, but Val, last time we talked, you mentioned hospitalizations were among the most important metrics to watch. And unfortunately, it's become politicized. I tried to get this information recently to find the difference, but I couldn't. Isn't it important to track, and not saying that it isn't a problem, but isn't it important to track who's hospitalized for COVID and who's in with COVID, meaning they're there for something else, but they tested positive and they don't have serious, when we're talking about public health, not necessarily for hospital administration, but for policy, don't we need to know who's there for COVID and who's there with COVID? And should those numbers be made public?
So I'm actually going to let some of our clinicians answer that question, but I do think as a broad statement or broad answer to that, our hospitals are very full, and anyone who is hospitalized, whether their admitting diagnosis was COVID-19 or they were found to have it after being tested upon arrival, that creates a specific burden for our healthcare workers in the hospital. And so it's the sum total of the patients and the sum total of those that have COVID that really adds to the challenges that our hospital workers are facing. But does one of our clinicians want to talk about that, but what that experience is like for you in the hospital?
Sure, I can speak. This is Neil Galati, Pottstown Hospital. I can mention Tower Health has a COVID-19 dashboard in which they publish daily number of COVID tests that are done, number of COVID-19 hospitalizations, and how many of those COVID patients are in the ICU. And they break it down between vaccinated and unvaccinated. I think it's a great resource to kind of show the power of the vaccine and how it limits the hospitalizations and ICU stays and intubations. I hope that was what you're looking for.
Jim, Sean Salkin with Mainline Health. I could also add to that a little bit. We are still, the vast majority of the patients that we are seeing in our hospital are unvaccinated, and those individuals are there for COVID. We are seeing others that are coming in, but it's hard to make that diagnosis and make that decision whether or not it's COVID related or not. So you could have a patient who comes in with a hip fracture, who's debilitated at home from their COVID. Now they turn to be COVID positive. They're really there for the hip fracture, but COVID was definitely a contributing factor to it.
A quick follow, unless anyone else looks like that's it. A quick follow up. I know staffing has been a major issue, and are there concerns about how things are being handled? Do you think we're moving in the right direction as far as we're handling, how people have to deal with a positive test, as far as staying out of work and as far as the time that people have to stay out? Are we moving in the right direction? Should we reconsider that to help with staffing issues, or any thoughts on that?
Jim, hi, it's Bob Sensola from Einstein Montgomery. Staffing shortages exist everywhere, as you know, outside of healthcare and within healthcare. It's put a strain, I think, probably on all health systems. We're actively addressing our staffing concerns. Our administrative teams have been wonderful about trying to recruit and to redeploy staff members for various departments to help cover needs within the medical center. And I think that the changes in terms of the CDC guidelines with the 5 days and improving symptoms or no symptoms and allowing people to come back to work sooner has been a big benefit. So I think that we've done everything that we can in terms of thinking outside of the box, for lack of better words, in order to make sure that we're having our employees return as soon as possible should they end up with COVID, on top of just generalized staffing shortage, not even related to COVID in the first place.
Thanks.
Okay, now we will go to Erin McCarthy with the Philadelphia Inquirer.
Hi, all. My question is probably best for Commissioner Akush, but anyone is welcome to weigh in. You mentioned, Doctor, that there are reasons to be optimistic, yet also we aren't out of the woods yet. Some of the data, particularly with cases, but also with hospitalizations to a lesser extent in recent days, has indicated that cases seem to be declining over the last couple of days. Do you think there's reason to believe we may be at the peak of this surge, or do you hesitate to say that? And if so, why?
I'm cautiously optimistic that we have seen the peak and that we are starting to trend downward. That is certainly what our data suggests. But I need to just point out and remind everyone that we are still seeing over 1,000 cases a day on average, which is more than we have seen at any point during this pandemic. So while I am really pleased to see the trend is starting downward, the total volume of cases is substantial. And because the volume of cases is so high, there will be ongoing impacts for our hospitals. We all know that the hospitalizations lag a few days, sometimes even a week, from that initial diagnosis. So I think it is fair to say that our hospitals are still very much in the thick of this and probably will be in that place for a few weeks to go yet. So it just underscores the importance of getting vaccinated, getting boosted, keeping a good mask on indoors, and just continuing to be cautious.
And have you heard any more information about the governor and the Department of Health's plan that was released a couple weeks ago? We were waiting for more details on that, but it seemed to indicate that there might be overflow sites coming, or support sites rather, for hospitals, nursing homes, and places like that. Have you heard any more details about that? And do you think that will be helpful and come in time?
Well, at this point in time, I am not aware that any Montgomery County hospital has put in a specific request for help of that type. And that being the case, we're at status quo right now, as you've heard from the folks today, and feel free, our clinicians can certainly comment. They're managing, and they're full, and their staff are doing heroic work, but they are managing at this point. Does anyone else want to add to that?
Okay, thank you. We will now go to Deanna Durante with NBC 10.
Good morning. I'll start with Dr. Arkush, but if any of the other medical experts want to weigh in, prior to the holidays and during the holidays, I did interviews with the Montgomery County Health Department that were really urging getting tested. You want to gather with people, you want to go see grandma, you want to see your relatives for Christmas, go get tested. So with a shortage of tests that we've seen through the pandemic, it seems like we should have seen this train coming down the tracks where everybody was going to run to go get these tests when they were being encouraged to do it, even when you could no longer book tests at the county sites. I had said, there's people that still need tests and now they can't get them, or people trying to test their kids and get them back to school. Should you be rolling back on the testing here? And this health department said everyone who wants a test should go get a test. That said, now seeing the shortages and the fact that these home tests are not picking up Omicron, which some of the experts on this call have said is what's really permeating the area. Any concern now on rolling back who should be getting tested, or putting limits on, if you have symptoms, if you don't have symptoms, the way that they've done it in other states to try and keep the tests for those who really need them?
Well, first, I just want to comment that I think we have some really critical and fundamental work to do to rebuild the public health infrastructure in our country. I would have loved to see that every household had a couple of at-home tests sitting on their countertop, as fall was arriving, just in case they needed them because they were having symptoms, or maybe their children were having symptoms. But that is not the situation that we found ourselves in. And here at the county level, we heard loud and clear from our hospitals that what they needed was help with more access to tests. We very quickly ramped up to add 1,500 tests a week to our county testing sites. And that so far seems to be meeting the need. Those sites now have appointments available, and it seems that most people can get in pretty easily if they need to be tested. Would be happy to hear from some of the other clinicians on the line. The data that I've seen from CDC is that these antigen tests are doing a good job of picking up the Omicron variant. And what's important about that, and this is true for any of the variants, is that the at-home tests are most accurate when you're having symptoms. They are a little less accurate when you're not, but that has been the case with every variant of this virus. Would anybody else like to chime in on that?
It's Neil Glady. I could totally echo what you said about it, the at-home antigen test being more accurate if you have symptoms. So I'd recommend if you have symptoms, you could trust the result of that at-home test. Otherwise, PCR testing is available at these testing centers that Dr. Arkush mentioned.
To follow up on that, I mean, Dr. Arkush, you're saying that you would have loved to have had people in the fall having those tests at home, but we knew that they didn't have those tests at home when they were being urged by multiple health departments, again, including this one, to go get tested if you want to gather. And again, if these home tests only work if they have symptoms, and why not just say, if you have symptoms, stay home and stop with the testing and save them? Again, the question is for those who really need them, rather than using them because you want to gather at a birthday party or you want to do this. If we really need to get the tests to people who need them so that then we can give them the antivirals, why not pull back on the testing so then people don't go to the ERs, people don't flood the systems here to get a test if they don't really need it?
I think that it was a strong strategy to encourage people who wanted to gather over the holidays to get tested. And I want to be very clear here. It's not that these tests don't work if you're not having symptoms. They do, but they are the most accurate when you're having symptoms. So it is possible that these tests could miss a very, very early infection. But if you take that test and then you go, right into a gathering, you're probably still okay for those next few hours, even if you have a very, very early infection. You may not yet be contagious. So there absolutely was a role to use these tests for the holidays during gatherings to help keep as many people safe as possible. And again, I just want to underscore the importance of making sure, as we learn from this entire pandemic, that we need to make the things that we need in this country. And one of our problems has been the ability to ramp up the manufacturing of these test kits, of PPE, of ventilators in the early days. We need to learn from this moment and make sure that we have these things in place here in our country. So when we need to ramp up production of critical items for response in a pandemic, we've got the ability to do that.
Okay, thank you. We will now go to Rachel Ravina with Montgomery Media.
Hello, this question is for any of the clinicians on the call that would like to answer. After 2 years of medical personnel and staff on the front lines against this public health crisis, what is morale like at these hospitals in Montgomery County now?
Hi, Rachel. It's Bob Sincilla from Einstein Montgomery. I certainly am not going to lie and say that there's times where morale has been tough, but certainly, certainly speaking of my team and our team here at Einstein Montgomery, and certainly probably within the entire Jefferson health system, people are resilient. Our healthcare workers have been amazing. They find ways to support each other every day. One of our nurses just put together an entire program for the month of February to show the love to our outside ancillary departments where we're taking care of one another. I think that it's really, really important that our patients understand that we come to work every day because we have a calling and we want to be here to look after those in need. And we're going to continue to do that. And while we certainly have days where we struggle and it can be hard and it can be frustrating, we're not giving up, and we're going to get through this together.
I would agree with that. It's Keisha Martin from Redeemer Health. I would absolutely agree with that. It's difficult to come to work every day when the volume of patients who present to your emergency department is day after day, 40, 50% more than you are typically accustomed to dealing with. However, we are pulling from other resources. We're pulling other staff from other areas to help out. We are aggressively recruiting. Redeemer Health, being a Catholic health system, has the support of the sisters in pastoral care as well. And we're keeping our heads up. It's definitely difficult right now. However, we're doing everything we can to make this bearable for everyone. And our staff really just want to take good care of everyone, of all of our patients. And so
Thank you.
Okay, we are going to do our last call for questions. So we're going to go back to Jim Melwert at KYW.
For clarification purposes, because it sounds like there's a little bit of confusion, what is the recommendation? When should people be getting tested? When should people, if I do an at-home test and it comes back positive, do I need to go get a PCR test? Should I just assume I have it and do what I need to do? What's the recommendation?
Any of our clinicians want to take that?
I can take that one. Val, this is John Stallkamp from Mainline Health. If you're taking an at-home COVID test and you turn out to be positive, there's no need to go and get a confirmatory PCR testing for that. You're fine with that. I would treat that as a positive. I'd isolate yourself, mask yourself, and get back to kind of full back to work after about 10 days or so. If you're still having symptoms and that test is negative, I wouldn't 100% count on the test 100% that it's there. And that's a good indication maybe to talk to your doctor about going out and getting a confirmatory PCR to make sure you are negative in that area.
So symptoms with the negative doesn't rule out that you don't have it, but if you have symptoms and you have a positive, just take the steps to quarantine, et cetera.
Correct, Jim.
Thanks.
Okay, and that concludes our questions for today.
Great. Thank you.